This ultrasound study is that of a 16 years old young unmarried girl, and this is the urinary bladder in transfer section.
I'm married.
This is urinary bladder in longitudinal section. Now this is the uterus in longitudinal section. बच्चे कितने?
कोई नहीं सर। कोई नहीं।
This is the uterus in longitudinal section, measuring 6.1 by 2.5 centimeters, and is okay, keeping in view the nulliparous size. This is the urinary bladder. This is the longitudinal section, that of the uterus. And here you see there is small amount of fluid seen in the pelvic cavity. This is fluid, and there is a mass. This is in fact a mass that we will study later on. First, let's see the uterus and concentrate on the uterus to start with. Now this is the uterus in transfer section. Okay, now this is the uterus in transfer section. This is the endometrial canal, central, clear, measuring 4.4 mm. This is the uterus in transfer section. In transfer section it measures 2.8 centimeters, and being the nulliparous, it's within normal dimensions. Now when I move the probe from the region of the right adnexa or right pelvic region, and you see now this is a mass. This is a mass, solid. This is a mass, and this is the iliac vessel, right iliac vessel. Now this is the uterus. This is the uterus, and from here this is the mass, which extends further, so I will not take the dimension, but and this is the fluid that we was initially seeing in the pelvic cavity. With no history of surgical intervention, any surgical intervention before, now here what we see is that the mass extends up to the right lower abdominal quadrant. Now mass moves laterally. You see, this is the uterus. This is the uterus, and from the fundus of the uterus, separate, not relating to the uterus at all, we see a solid heterogeneous mass that extends anterolaterally up to the lower abdominal quadrant, and it measures approximately this mass measures approximately 8.8, or I will say 9 into 4 centimeters. This is the mass. It's hypopoic, predominantly hypopoic, and this is the fluid in the pelvic cavity. This is the part of the uterus we are seeing, and we can see this mass extending from the region of the pelvis up to the, now again to show you the uterus. This is the uterus, and this is the mass. But this mass, now it extends from the posterior surface of the uterus, and then it's seen extending up to the lower abdominal quadrant with iliac vessels seen running posterior to it. These are the iliac vessels that you are seeing. These are the iliac vessels that are running posterior to this mass. And let's study this is the transverse section of a mass. This one, and see that the mass is mixed tissue, has tiny cystic areas within it. It's well demarcated. There is no calcification seen. This is the mass in transverse section, measuring approximately 4.7 into 5 centimeters. And its appearance is inhomogeneous, has multiple internal cystic areas. You see, this is a cystic area, this is the larger one. The outer surface can be seen. Multiple cystic areas are seen within it. This is a cystic area, this is a cystic area. And now this is one aspect of this patient's pathology. This is the fluid in the pelvic cavity. This is all fluid, this is fluid, this is fluid, and when I move the probe further upwards in the region of the right hypochondrium, I see fluid in this region as well. This is the liver. Now first to see is that the outer surface of the liver is smooth. The echogenicity of the liver is normal but appears to be raised because of the fluid surrounding its posterior surface. This is the fluid surrounding the anterior surface. This is the anterior surface of the liver. This is liver. Okay. Next. This is the kidney. There is no mass seen relating to the upper pole and lower pole. Kidney is normal. Dimensions are appearing normal. There is fluid in the hepatorenal angle, which is extending to the Morrison's pouch. This is the liver. This is the kidney. This is the fluid. It is extending to the Morrison's pouch. That we will see in a moment. Here you see, this is the kidney transfer section, this is the fluid, this is the liver, and these are the bowels in the region. Now this is the gallbladder. The gallbladder is neat, clear, wall is not thick. There is one significant finding that I am going to show you now, and that is there is a serpendious shaped vascular area or tubular structure seen in the region of aorta hepatis extending into the liver, which is consistent with cavernous transformation of the portal vein, because as such you can't see patent single vessel. So this area, this tubular serpendious shaped area with clear human evidence, then is the cavernous transformation of the portal vein, or you can say the recanalization of the portal vein, which is seen in cases of long-standing or chronic portal vein thrombosis. So this is the another finding, that is the cavernous transformation of the portal vein. Here I'm going to show you again. We know that the portal vein courses posterior to the neck of the gallbladder. This is the gallbladder, neck of the gallbladder. This is the portal vein being formed into what we call as the canalization or cavernous transformation of the portal vein. The liver is not cirrhotic, is normal in appearance. This is the spleen, and from pole to pole the spleen measures 12.2 up to 12 is normal, so we will consider it as a normal spleen. This is the left kidney. The left kidney is okay. Now there is, you see, fluid in the left Morrison's pouch as well, and that is seen extending into the left paracolic gutter, because this is the iliopsoas muscle, this one. This is the iliopsoas muscle. These are all bunches of vessels, and you will see the movement of vessels in it. And the black area, this area, this one, this is fluid in the left paracolic gutter. This is all fluid, and the bowels are floating in this fluid. You see, these are all bowels. You can see the movement of these segments of bowel, and this area is representative of fluid, with this being the left iliopsoas muscle. Note the movement of the vessels within the fluid. The vessels appear to be matted together as per their appearance. And now, when I move the probe downwards, we come across the mass. Now this area gives so much gas is seen in this area. This is the area of epigastrium. However, there is no evidence of any para-aortic adenopathy. However, now if you concentrate on this region, you will see that this is the aorta in longitudinal section. These are the matted bubble segments, and these are the ascitic fluid in which they are floating. And this is the fluid in the right paracollic gutter, and you can see again same configuration as you saw in the left side. These are bubbles. These are all bubble segments, and this is all fluid. उम्र आधे घंटे तक मैं टूट जाऊँ टाइम की हाँ तो बस 4 बजे तक मेरा टाइम अच्छा okay now there are findings. Number 1, the cavernous transformation of the portal vein. Here it is showing you again. Ascites, matted bowel segments, attached with the mesentery. Here you can see that. Cute. All bowel segments, they are attached with the mesentery. And they give the appearance on both sides. Now I have placed the probe just above the umbilicus, and I am moving the probe towards the left, and now I am moving the probe towards the right. Now transverse. So this is the mass. This is the hydrocerebral muscle. Again, the fluid in the pelvic cavity. What is this region? In this region, we see fluid with echoes. This is fluid with echoes. Coming to the pelvis again. Now you see this is a thick mesentery. This is a thick mesentery, this region, this area. This is thick mesentery, and this is representative of omentum, thick mesentery, fluid in the pelvic cavity, the uterus. This is the mass which is extending the midline just above the urinary bladder. This is the urinary bladder, and as I move the probe anteriorly, superiorly, this is the uterus, and then this is the mass in this region, area of the mass seen in this region, extending both sides of the midline. Now with transabdominal technique, it's not easy to get the, it's really become, this is the ovary, this is the ovary, this is the left ovary, and this is the right ovary, seen displaced posterior to the uterus. This is the uterus, this is the endometrial canal, and this is the right ovary that has been displaced posterior to the, this is the ascitic fluid, this is the uterus, this area, and this is the ovary. So this is a case study of a 16 years old female with a solid hypoechoic mass extending from the right pelvic region up to anterior of the urinary bladder, then extending on both sides of the midline in the suprapubic region. And here you see, again I want to show you this. This is the urinary bladder. As I will move upwards, you will come across the uterus. So this is the uterus. As I will move upwards, you will see the mass. This is the mass, and you can see as a dumbbell shaped, it gives you an appearance of a dumbbell extending towards the left, this side, and in the suprapubic region, and then extending towards the right side. But this left side and extension of the mass ends over this, over just above this suprapubic area on the left side, whereas the mass on the left side, right side extends up to the lower abdominal quadrant. This is the larger. So in fact it is one mass, but having extensions and expansions with ascites, with cavernous transformation of the portal vein, and with matted bowel segments all over the abdomen. So this is our case of the day. Thank you very much. Now it's very important to show in all such cases of cavernous having cavernous transformation of the portal vein, to show that the IVC is patent, and you can see the IVC or not. Here we can see the IVC. This is the inferior vena cava, this proximal and veritatis the heart. So it is seen. Then I would like to see the hepatic vein. Here you see this is the middle hepatic vein. So middle hepatic veins are seen entering the IVC, and you can see it is having sharp margin, rules out any pathology related to the liver parenchyma. So in all such cases, actually this is done to showing the IVC and the hepatic veins. The actual reason for it is to rule out any possibility of Budd-Chiari syndrome. So we do see the vessels, hepatic veins, and as well as the IVC in this particular case. Thank you very much.